Today here you are welcome on Nexus Medical Media. I'm Dr. Akanksha and today we are going to talk about murmurs. There have been so many questions asked on this and that's why I want to have your little focus on this topic for today's class. So let's talk about from the basic and we will brush it up. We have S1, S2, S3 and S4. These are four sounds that we have. Okay, let's try to get deeper. When the S1 will start, of course all of you must know it is from the closure. I'm just gonna take 1 second of yours and I'm going to ask you, I think all of you know that this is the closures of valve. S1 and S2 both are the closure of valve. Can any one of you point it out for me that which closure I'm talking about? It is the mitral or is it just aortic or is it going to be pulmonary? So when you talk about the S1, it is going to be a mitral valve, or I think it would be better to say if I will say, and let's just change the color over here, everything would look like black otherwise. So it would be your tricuspid and as well as bicuspid valve. Okay, so the both of them are going to get closed and at that time you will have only S1 sound. Yeah, confusing, I know, for me it was as well. So when I say S1 valve, so you are going to have the closure of mitral and as well as bicuspid. Both of them you will have the closure. Okay, the tricuspid, bicuspid both will be getting closed at this point of time. Next, when I say S2, what do I mean by that? When I'm going to hear this sound. So this sound you will be hearing at the closure of your semilunar valves. What semilunar valve do we have? It is aortic and as well as you have pulmonary. Okay, so these are two valves which are going to get closed and you will hear the sound which is S2. Now S3 and S4, when you are going to hear those sounds, so you have these both as called as rapid filling sounds. Okay, when I say S3, it means that it is early diastole. Yeah, this one would be your early diastole and S4 would be your arterial systole. I hope you have all covered it and everybody have written it with me. Now let's try to be better and see in this figure and we will try to figure everything out which I have just said to you within a minute. Okay, please be little focused guys, because it is actually looks like very easy, but once you dig deeper you will be confused. Okay, so let's see in this figure. It's a very beautiful picture that I have collected. So when you see, you already know that from the where blood will come and from where it will go. So let's look over here. You already have seen that it is coming into the right atrium and then it is going into your right ventricle. Yes, of course. Okay, so when we will see what's happening over here, of course, when the blood will come from your superior vena cava and it will move into your right atrium, it will go into your right ventricle. So once it will go into your right ventricle, what will happen? Won't you have the closure of the valve over here? Of course we will have, right? So once the closure will happen of the mitral valve, then what we will call it? We will say that we have heard the S1 sound. Okay, and then after that you have this one over here. We have this valve over here as well. Which valve would it be? Don't you see that we have a pulmonary artery going from here? So what sound we are going to hear at this time? We will be hearing S2 sound. Okay, and we know that all the blood wouldn't be just gone within one time, so there would be some blood left, but again we will have to have a diastole starting over here, so we will call it as early diastole. Okay, and at that time what sound you guys are gonna hear? That would be your S3 sound. And now at last, what will happen with the atrium? Wouldn't it have again a systole? Wouldn't it try to contract and give some more blood to the ventricle? And wouldn't it try to say, just take all the blood that I have and be just done with it? So that time you will be hearing your S4 sound. Okay, so this was a very beautiful start of this topic. I hope everybody here is getting what I'm trying to comply. Okay, let's just move a little bit ahead and I'm just gonna ask you a very simple question. When I say S1, S2, and again I'm going to say S1 and S2, where you gonna see it? In systolic, what it would be, and in diastolic, what it would be. Let me be a little helpful for you again one more time for this class. when I say S1 to S2, at this time I'm saying that this is systolic. But my friends, if I say from S2 to S1, then I'm meaning to say diastolic. And most of the time in exam you will have a complete brain barrier break. So at that time you have to remember that S2 से होता है diastole. From S2 it will happen to have a diastole. So you will have S2 to S1 happening in your diastole. So at this moment this is enough. I'm going to discuss a lot more about murmurs. Please give us a thumbs up to this video and tell me if there is anything I would add. And I hope I have given a very beautiful summarized explanation for the starting of murmurs. And yes, of course, one more thing that I would want to add over here, that why murmurs happen and what is the reason. So for that, please do remember, when I say murmur, it is just nothing but the altered blood flow. Okay, it is nothing but happening due to the altered blood flow. And in all of the cardiac disease we will have some kind of a murmur, and I want to discuss all of them with you. Okay, so please be focused for this class for a few more time being that we are going to be together in the future. So what can be the causes? Firstly, it would be stenosis. Stenosis is what? It is going to be the narrowing. Next one, when I say insufficiency, of course, I just told you right now when the sounds are gonna come from. So if you will have a valvular insufficiency, don't you think it is gonna be a very big problem? And then you have a congenital anomaly, my favorite topic because I have taught you this before. You have PDA, you have VSD, everything. Of course, if this is going like that, you are gonna have a problem. And the last one, if you have an increased blood flow. Okay, by when I say that the increased blood flow, I do want to mention one more few things over for you guys. Please do remember for me that in S3, okay, in S3, when the S3 will come to you, but it will be completely normal. Please do write down that with me as well. That when I say S3, guys, it will be normal at the time of pregnancy. Okay, it was going to be normal at the time of pregnancy. It is going to be normal for Paget's disease, and we are going to see it at the time of hyperdynamics, right? Because it is the rapid filling, guys, of course. So everything is just going to be filled up very soon, and because the early diastole is coming in the picture. So at that time, you need to remember that the pregnancy, Paget's disease, these are the time that it is just gonna be normal. And where you will see the problem will lie at S4. And please do not forget to come back over here again, because I want to explain all these pictures to you, because we have mitral valve prolapse, pulmonic stenosis, aortic stenosis, your myopathies, arterial septal defect, and tricuspid, and everything. So please do come back here one more time to be continued on this topic. Thank you.